The German Shepherd exploded through the corridor like a freight train with teeth. 3 military handlers hit the floor. A veterinarian slammed herself against the wall and screamed. 2 orderlies ran. The massive dog, 94 pounds of combat-trained muscle and fury, stood in the center of Hartwell Defense Medical Center's trauma wing, chest heaving, black lips peeled back, and not a single person in that hallway dared move. Then a young nurse nobody had ever taken seriously pushed open the stairwell door, looked at the dog, and said quietly, "Hey, I got you." The dog stopped, turned, and walked straight to her. Before you go any further, if this story already has you hooked, please subscribe to my channel, hit that like button, and drop a comment telling me what city you're watching from. I want to see how far this story travels. Now let's get into it. The morning had started the way most Tuesdays started at Hartwell Defense Medical Center, with somebody's ego getting in the way of somebody else's job. Nora Voss arrived at 6:47 a.m., 13 minutes before her shift was supposed to begin, because she'd learned early on that showing up exactly on time at Hartwell was the same as showing up late. The trauma wing ran on a rhythm that didn't care about clock hands, and if you weren't already in motion when the 7 a.m. chaos hit, you were behind. She changed into scrubs in the locker room, tied her dark hair back with the rubber band she kept around her wrist, and drank half a cup of coffee that tasted like it had been brewed sometime around 1994. Hartwell wasn't a glamorous place to work. It sat on the eastern edge of Calverton, Virginia, a mid-sized city with a large military presence and a downtown that was still figuring out what it wanted to be. The medical center had been built in the 1980s to serve both civilian and active-duty military patients, and somewhere over the decades it had developed a dual personality, part community hospital, part federal contractor facility, with a wing on the 3rd floor that handled specialized cases nobody talked about much. The building showed its age. The fluorescent lights in the trauma wing flickered when the HVAC system cycled. The elevator on the east end took 45 seconds longer than the one on the west. Little things. The kind of things you stopped noticing after your first year. Nora was in her 4th. She'd come to nursing the long way around, and that was the polite way to put it. There were people on staff who knew pieces of her history, the years before nursing school, the work she'd done that wasn't hospital work, but most didn't, and Nora had never gone out of her way to fill in the blanks. She did her job. She did it well. And she had learned, slowly and not without some pain, that doing your job well at a place like Hartwell did not automatically translate into being taken seriously. That particular lesson had been reinforced over and over by Dr. Garrison Holt. Holt was the department supervisor for Hartwell's trauma wing, a title he carried with the energy of a man who had been told he was exceptional so many times that he'd stopped questioning it. He was 43, broad-shouldered, and possessed of the specific kind of confidence that came not from competence, but from years of never being contradicted by anyone who mattered. He ran the trauma wing the way certain people ran meetings, by making sure everyone understood that the point wasn't to get things done. It was to make sure everyone knew he was in charge of things getting done. Nora had crossed him twice in her first year and learned from both experiences. Not that she'd been wrong either time. She just learned that being right wasn't always the thing that mattered. She was checking the medication cart outside room 114 when she heard raised voices coming from the end of the corridor near the service elevator. Not patient voices, staff voices. The kind of raise that meant something had gone sideways. She pushed the cart aside and walked toward the noise. The service elevator doors were open, and standing in the gap, or rather, planted in the gap because the man wasn't moving, was a figure in a dark green military uniform. He was somewhere in his mid-40s, broad-framed, with close-cropped gray at his temples, and the kind of stillness in his posture that you either had or you didn't. Beside him, on a military-grade leash with double clip points, was a German Shepherd. The dog was enormous. Not fat enormous, lean, dense, built the way working dogs got built when they'd spent years doing actual work. His coat was the classic black and tan, darker than most, and he held himself with a precision that made him look like he was always slightly at attention. His name, Nora would learn in the next few minutes, was Rook. The man holding his leash was Colonel Desmond Farr. Facing him, with the particular posture of someone who had decided they were going to win this conversation no matter what, was Dr. Garrison Holt. "Colonel, I understand what you're saying, and I respect your service. I do. Holt was using his careful voice, the one that sounded reasonable but wasn't. But this is a medical facility. We have protocols. The evaluation was scheduled for the veterinary suite on the lower level. If the dog is presenting behavioral issues on transport, that's a veterinary concern. He's not presenting behavioral issues. Farr's voice was flat and completely unhurried. He's presenting anxiety. There's a difference. With respect, doctor, I've been working with this dog for 6 years. I know what he looks like when he's anxious, and I know what he looks like when he's dangerous. And right now he's anxious because there are 18 unfamiliar people in a small space and the ventilation in your elevator smells like industrial cleaner. That's not a behavioral issue. That's a reasonable response to an unreasonable situation. Holt's jaw was doing the thing it did when he was trying to figure out how to disagree with someone without technically disagreeing. Nora had seen that jaw do its work many times. Rook, for his part, was sitting beside Farr with rigid attention, his dark eyes moving steadily across the hallway in both directions. Every few seconds his gaze passed over Nora. It didn't land on her, not yet. He was still doing inventory. The standard protocol for military working dog evaluations at this facility, Holt started. I know the protocol, Farr said. I've been bringing dogs through this facility for 8 years. What I'm telling you is that Rook needs 5 minutes in a quieter space before we proceed. Not a treatment room, not the veterinary suite. Somewhere without the foot traffic and the noise. That's all. We don't have a room configured for... I'm not asking for a room configured for anything. I'm asking for a hallway. The two men stared at each other for a moment. Holt glanced sideways, which was what he did when he was looking for an audience or an out, and his eyes landed on Nora. She recognized the look immediately and braced herself. Voss? Holt said her name like a peer at the end of a sentence. Don't you have a cart to finish? I was checking on the noise, she said. Well, now you've checked. He said it with the lightness of a man who thought he was being funny. She didn't move. Something about the dog held her there. Rook was watching her now, had shifted from his general survey of the corridor to a focused attention on her specifically. Not aggressive, not alert in the way dogs got alert when they were deciding whether to act. Something else. Something she couldn't quite name. Is there something you need, Voss? Holt asked, patience fraying at the edges. No, she said. Sorry. She went back to her cart, but she kept watching. The scheduled evaluation was supposed to take 40 minutes. By the time Nora finished her medication round and circled back, an hour had passed and nothing had been evaluated. She could hear the situation from the end of the hallway before she saw it. Rook had been taken to the quiet room, a small consultation space near the stairwell that was used mostly for family meetings. And at some point in the last hour, he had gone from anxious to something that looked a great deal more volatile. There were now 3 handlers from the military veterinary unit clustered outside the door, all of them in tactical vests, all of them speaking in the low, urgent tones of people trying to project calm they didn't actually feel. Dr. Petra Moss, the facility's contracted military veterinarian, was standing beside them looking at a tablet. She was competent and no nonsense, and in Nora's limited experience, she was one of the few people at Hartwell who didn't perform her expertise. She just had it. But right now, Dr. Moss looked like she was doing math she didn't like the answer to. Colonel Farr was outside the door with his arms crossed, and whatever expression was on his face, it wasn't panic. It was something harder than panic. It was the expression of a man watching something go wrong that he'd been warning people was going to go wrong. Nora slowed her pace. From behind the closed door of the consultation room, she could hear it, the low repetitive vocalization of a dog that was past the point of listening to commands. Not barking, not snarling, something worse, a sustained, cycling sound that sat at the intersection of distress and warning. He's been like this for 40 minutes, one of the handlers said. I was young, maybe 25, with the look of someone who'd been in tight spots before but hadn't quite been in this specific tight spot. Every time we crack the door, he escalates. We've tried the full protocol. He's not responding. Give me the tablet, Dr. Moss said. She was looking at Rook's file. Last behavioral evaluation was 14 months ago. Clean. What changed? Nothing changed, Farr said. Moss looked at him. He's been declining for 3 months, Farr said. Subtle, sleep disruption, appetite variations. Nothing that flagged on the standard screens. That's why we're here. He needs a full workup. Colonel, if he's in acute distress right now, we need to discuss sedation options before. Don't sedate him. Farr's voice was quiet but absolute. He's not dangerous. He's in a state. There's a difference. With a dog his size in an enclosed space, he won't hurt anyone in that room. With respect, sir, we can't guarantee. I'm not asking you to guarantee anything. I'm telling you what I know. The three handlers exchanged a look. Dr. Moss pressed her mouth into a line. Nobody wanted to be the person who disagreed with a colonel about his own dog. But nobody also wanted to be the person who sent an untrained staff member into a room with 94 pounds of escalating military working dog. Holt arrived. Nora heard his footsteps before she saw him, the particular rhythm of a man walking faster than usual because something was happening that he wasn't in charge of, and he intended to fix that immediately. What's the status? He looked at Moss, not far. Moss gave him the short version. Holt's face went through 3 calculations in about 2 seconds. The first was determining whether this was a liability issue. The second was determining whether he was going to look bad. The third, and this was the one that settled into his expression, was determining whether there was an opportunity here. He looked across the corridor. Nora was still there. She'd stopped pretending to do anything else. Voss, Holt said. He had a particular tone for her name when he was about to do something unpleasant with it. Didn't I hear somewhere that you had some kind of background with animals? She kept her voice neutral. I've worked with dogs. Right. He said it in that way, that careful, slightly amused way, that communicated to everyone watching that he was humoring her. Well, if the veterinary professionals and the military handlers are having trouble, he gestured at the door with the exaggerated openness of a man offering someone a gift he was sure they'd drop. Maybe you'd like to take a crack at it. The handlers looked uncomfortable. Farr was watching Holt with an expression that Nora could not read. She understood what was happening. Holt wasn't asking for her help. He was setting up a demonstration of her limits, letting her fail spectacularly enough that no one would question his authority on what came next, which was almost certainly going to be sedation over Farr's objection. She looked at the door. Behind it, Rook's vocalization cycled again, that same complex distress warning sound, and for a second it caught somewhere in her chest in a way she hadn't expected. Yeah, she said. Okay. Holt blinked. He hadn't actually thought she'd say yes. Voss, I should be clear. I'm not authorizing you to. You just asked me if I wanted to try. She looked at him steadily. I want to try. Well, the handlers briefed her in 60 seconds outside the door, which was enough time for them to tell her not to approach directly, not to crouch, not to make eye contact, not to use command language, and not to reach toward him. She nodded at each one. She didn't tell them that most of what they'd just said was wrong for this specific situation, because there wasn't any good way to say that without sounding like she was performing knowledge she hadn't demonstrated yet. Dr. Moss touched her arm before she went in. If he escalates, back to the wall. Don't run. Don't turn your back. I know, Nora said. Something shifted in Moss's eyes. Not skepticism exactly, but a recalibration. She stepped back. Colonel Farr hadn't said anything through the briefing. He was watching Nora the way he'd been watching Holt, steadily, without judgment, taking information in. She opened the door. The consultation room was small, 12 by 14 maybe, with a round table, 4 chairs pushed back against the wall, a window with frosted glass that let in pale morning light. The overhead fluorescents were on, too bright. Rook was in the far corner, back partially to the wall, and when the door opened, he turned toward it with his full body. Hackles raised, weight forward, eyes fixed. Nora stepped inside. Closed the door behind her without looking away from him. He was even bigger up close. The hackles along his spine made him look wider, and his posture was the compressed, charged posture of an animal that was not going to back down and was deciding whether to move forward. His mouth was closed, which was something. Closed mouth was better than the peeled lips she'd heard about from the handler's description. But his breathing was too fast, and his eyes were everywhere. She didn't approach. She didn't speak. She moved to the left side of the room. Not toward him, not away, just a lateral shift. And then she did the thing that the handlers had specifically told her not to do, and she sat down on the floor. Not crouched, sitting. Legs loosely crossed, back against the wall, hands open in her lap. She looked at a point on the floor about 3 feet in front of her. From outside, she could hear muffled voices, Holt saying something, one of the handlers responding. And then it all went quiet, because apparently someone out there had the sense to tell people to stop making noise. In the room, the only sounds were the fluorescent lights buzzing and Rook's breathing. She waited. 20 seconds. 30. The hackles didn't go down. He hadn't moved. She took a slow breath in through her nose, let it out through her mouth. Not performing calm. Actually getting there, which was different. There was a thing she'd learned years ago. You couldn't fake the physiological markers to a dog trained the way Rook had been trained. They read cortisol. They read heart rate through proximity. You had to actually be calm, or the closest approximation of it you could reach, and you had to be willing to sit in the discomfort of not knowing what was going to happen next. She was willing. 45 seconds. Rook's breathing changed. Still fast, but the cadence shifted. One longer exhale in the sequence. A small thing. Significant. She didn't look at him. A minute and a half. She heard his paw shift on the floor. Then the other. Then the slow, deliberate sound of a large dog moving across linoleum, and she kept her eyes on that spot on the floor and her hands open in her lap, and she waited. He stopped about 4 feet from her. She could see him in her peripheral vision, head low, ears still back, but the hackles were moving. Not gone, but diminishing. He was smelling her. Long, slow pulls of air, processing. She stayed still. He moved closer. 3 feet, 2. And then he put his nose against her hand, the lightest possible contact, more of a breath than a touch. And she felt something release in her chest that she hadn't known she was holding. "Hey," she said quietly. "There you are." He didn't startle at her voice. He pushed his nose more firmly against her palm, and she turned her hand over slowly and let him smell the back of it, the wrist, up the inside of her forearm, all of it at his pace and his direction. Then he sat down next to her, not touching, just next to her. She exhaled. Outside the room, nobody said anything. She sat with him for 7 minutes before she moved, and when she moved, it was only to shift her weight and let her shoulder come into contact with his without making a thing of it. He didn't move away. He leaned in slightly, the way a dog leans when it has decided something about you. By the time Dr. Moss opened the door, carefully, slowly, just enough to look, Rook's hackles were flat and his breathing had normalized, and he was sitting against the wall with Nora like they were waiting for a bus together. Moss stood in the doorway for a moment without speaking. Then she looked over her shoulder at the hallway and said flatly, "Somebody go get Colonel Farr." Farr came to the door, where he looked at his dog. He looked at Nora. His face did something complicated that he didn't try to explain. "Can we bring him out?" Moss asked. Nora looked at Rook. "Yeah, give it another minute. He's okay." She didn't say it like she was performing competence. She said it like she was reporting a fact, which was all it was. Holt was somewhere behind Farr in the corridor, and whatever expression he was wearing, she couldn't see it from the floor. That was fine. She wasn't thinking about Holt. She was thinking about Rook, and specifically about the way he had leaned against her, and about the particular quality of recognition she'd felt in it. Not gratitude, not submission, not the mechanical trust transfer that handlers trained for. Something older than that. Something she was going to have to figure out what to do with. Because when Rook had pushed his nose into her palm, before the lean, before the calm, he'd pressed his face against the inside of her wrist, where she had a small scar from a dog bite she'd gotten years ago. In a different life. Working with animals that most people forgot about the moment they were useful. And he'd held it there for just a second too long, like he was checking something, like he already knew the answer and was just confirming. She was still sitting on the floor of the consultation room, Rook's shoulder warm against her arm, when she heard Holt's voice in the corridor, lower now, trying to sound authoritative, trying to reclaim the narrative in front of the handlers and Farr and Moss. And she thought, there's going to be a problem here, not with the dog, with what the dog had just done. Because there were people in that hallway who had watched a nurse with no veterinary credentials walk into a room with a military working dog in acute distress, and come out with him calm and sitting beside her like a companion. And some of those people were going to need an explanation for that, and some of them were not going to like any explanation she gave. She could feel it coming the way you felt weather coming, that pressure change before the storm. Holt's voice in the hallway sharpening, the handlers deferring to Farr who wasn't deferring to anyone, Moss's silence, which was a specific kind of silence that meant she was already taking notes. Outside the frosted window, the morning light was changing. Nora sat still, and Rook sat with her, and neither of them moved yet. The thing about Garrison Holt was that he was never wrong loudly. He was wrong quietly, persistently, in ways that redistributed the wrongness onto whoever was nearest. By the time she and Rook came out of the consultation room, her standing, him at her left side without a leash, because she hadn't reached for one and he hadn't needed one, Holt had already begun his redistribution. The dog responded to de-escalation. That's textbook. He said it to Moss, not to Nora, as though Nora wasn't standing 3 feet away. Any trained professional could have achieved the same result with adequate time and proper conditions. Moss was writing something on her tablet. The concern moving forward is the evaluation itself. We're already an hour behind schedule, and we still need full vitals, the mobility assessment. I can walk him through the assessment, Nora said. Holt stopped. She'd said it simply, not as a challenge, just as an offer. But it landed like a challenge, because offers from Nora Voss that required Garrison Holt to acknowledge her capacity were, by the local physics of Hartwell's trauma wing, inherently challengeable. You're a trauma nurse, he said. I know. You're not a veterinarian, you're not a handler. I know that too. She glanced at Farr. Colonel, does Rook need to be walked by a credentialed handler for the physical assessment, or does he need to be with someone he's comfortable with? Farr looked at her for a moment. Someone he's comfortable with, he said. That's the only thing that's going to get us accurate results today. Holt opened his mouth. Moss spoke first. I'll supervise. Voss assists. Colonel Farr in observation. She didn't look at Holt when she said it. Let's get moving. We're already behind. Nora caught the exact moment Holt decided to let it go. Not because he agreed, and not because he'd been outranked, but because the math had shifted and fighting it now would make him look worse than accepting it. That was always the calculation with him. Not right versus wrong, cost versus benefit. She followed Moss toward the assessment room. Rook walked beside her, and in the hallway behind them, she heard Holt tell one of the orderlies, quiet enough to be deniable, "Document the time delays, all of them." She kept walking. She'd learned a long time ago not to turn around. Bossam. The assessment took 90 minutes and covered everything on Farr's original checklist: weight and body condition, hip and joint mobility, neurological reflexes, cardiac and respiratory function, a visual field test that Moss ran with quiet efficiency. Through all of it, Rook tolerated every instrument, every manipulation, every stranger's hand, not enthusiastically, not perfectly, but with the focused cooperation of a dog that had decided to extend trust. He kept orienting back to Nora between each exam section. Just a glance, just a check. She was there. He returned to what was happening. He's protective of his left hip, Moss noted, running her fingers along the joint while Nora held Rook's head steady. Could be early dysplasia. Could be an old impact site. I'll need imaging. He took a fall in year 4, Farr said from his chair in the corner. He'd been quiet through most of the assessment, not disengaged, just watching. Overseas, medics cleared him, but it was a significant fall. I'll want a full radiograph series. Moss stood, made a note. If it's dysplasia, we're looking at management, not treatment. I'll have recommendations by Thursday. Farr nodded. He was watching Rook again. Something in his face, not grief exactly, but the older cousin of grief. The particular look of someone who had been living with a thing they knew was coming and was watching it arrive on schedule. He's still mission capable? Farr asked. Even though Rook was technically retired, even though the question wasn't really about missions. Moss hesitated for exactly a second, which was itself an answer. I'll have a clearer picture Thursday. Nora was scratching behind Rook's left ear, the place she'd found 20 minutes in that made him close his eyes and lean into the pressure. And she was thinking about the scar on her wrist, and about what it meant that he'd gone for it the way he had, and about a year in her life that she had packed very carefully into a specific mental compartment and mostly left there. She wasn't sure how much longer she was going to be able to leave it there. Farr's eyes moved to her. Not for the first time in the last 90 minutes. You said you've worked with dogs, he said. Yes. What kind of work? She kept scratching. Rook's eyes were closed. Foster program. Military service dogs, mostly. I did it for a few years before nursing school. Farr was quiet for a moment. Which program? She looked at him. He was looking at her the way he'd been looking at her since she sat down on the floor of that consultation room, steadily, taking information in, processing it in some internal way she couldn't see the edges of. Ridgeline, she said, based out of Fort Carver. Something changed in his face. It was small, barely a shift, but she'd been watching faces for a long time and she didn't miss it. How long ago? He asked. 7, 8 years. She paused. Why? He didn't answer immediately. He looked at Rook, at the dog with his eyes closed and his ear pressed into Nora's hand, calm and heavy and entirely different from the animal who'd been cycling in distress an hour ago. Then he reached into the side pocket of his jacket and took out a small object she didn't immediately recognize, a square of worn fabric, like a patch or a folded photograph. Colonel, Moss said, not looking up from her tablet, I'm going to need you to sign off on the imaging request before you leave. Yes, Farr said. He closed his hand around whatever he was holding and stood. Of course. He didn't show her what was in his hand, but he didn't put it back in his pocket either. He held it as he moved to the desk where Moss was standing, and Nora watched him, and Rook opened his eyes and watched him too, and the morning light through the assessment room window had gone from pale yellow to the particular white of mid-morning Virginia, and somewhere in Hartwell's trauma wing, on the other side of a few walls and a locked door, something was shifting in a way that nobody in that room had a name for yet. Nora scratched behind Rook's ear, and he pressed into her hand, and she thought, I know this dog. Not figured out, not deduced. Knew, in the body way of knowing, the pre-language way, the way you knew a smell that belonged to a specific time and a specific place before your brain had assembled the words for it. She knew this dog. The question, growing louder by the second, was whether this dog knew her. The answer came 3 hours later, and it came from a dog. Nora was in the break room eating a sandwich she didn't taste when her phone buzzed with a text from an unknown number. 4 words. Can we talk? Farr. She sat with the message for a moment, then typed back a room number and hit send before she could think about it too hard. He showed up 8 minutes later, still in uniform, without Rook. The dog had been transferred to the lower-level veterinary holding area for pre-imaging prep, and Farr moved differently without him. Not diminished exactly, but less anchored, the way people moved when they'd left something important in another room. He sat down across from her without preamble, and put the folded object from his pocket on the table between them. It was a photograph, old enough to have a slight curl at the edges, the kind of photograph that had been handled many times and showed it. She looked at it without touching it. The image showed a dog, younger, maybe 14 months, still carrying some of the ranginess of early development, sitting in a backyard. The grass was overgrown. There was a wood fence behind the dog with a broken slat third from the left. The dog was looking at the camera with the frank, attentive expression that young shepherds had before they learned to be guarded. Beside the dog, sitting cross-legged in the grass, was a young woman. Her face was turned slightly away from the camera, dark hair loose, one hand resting flat on the dog's back. Nora looked at the photograph for a long time. Where did you get this? She asked. It was in his kit, Farr said. Standard practice with the Ridgeline dogs. The program sent a photo with each animal, something for the handlers to have. A reference point. Background. He paused. I've been looking at that photograph for 6 years. She knew the backyard in the picture. She knew the broken fence slat. Her landlord had never fixed it, and she'd stopped asking after the 2nd year. She knew the particular quality of the afternoon light in the image, which came from the northwest because of the way the property sat, and which meant the picture had been taken sometime in the late afternoon on a day without clouds. She knew the dog. His name was Kodak, she said, when he was with me. The program named them. I didn't choose it. His operational name was Rook, Farr said. Has been since he completed his training cycle. I know. She picked up the photograph. Held it. I knew what he'd become. That was the agreement with the program. You took them in understanding you were temporary. You were a bridge, not a destination. She set it back down. I didn't know which unit he'd end up with. They didn't tell us that. Farr watched her. He recognized you. Yeah. The moment you opened that door before you said anything. I figured that out when he went for my wrist. She turned her left wrist over on the table, the small scar, white and smooth now, running along the inside where the skin was thin. He bit me. Week 2. Not aggressive. He was spooked by a car backfiring, and I was between him and the fence. He knew immediately that he'd done something wrong. Spent the next 4 hours sitting outside the bathroom door while I cleaned it up. She pulled her sleeve back down. He always associated that scar with comfort after that, like it was his way of checking that I was still okay. Farr was quiet for a moment. "That's not in any behavioral file," he said. "No, it wouldn't be." The break room hummed around them. Someone opened the door, saw them, withdrew. The fluorescent lights were doing their flicker thing. "Why didn't you say anything?" Farr asked. "When you came out of the consultation room, when you saw how he was responding." "Because I didn't know for certain until the wrist thing, and after that—" She stopped, thought about how to say it. Because the room was already complicated, and adding another layer to it wasn't going to help Rook get through his evaluation. Farr looked at the photograph. "He's been declining for 3 months," he said. "Moss thinks it's partly physical. The hip? Possibly some neurological changes. But I've been working with dogs long enough to know when the body and the mind are both going. He's been carrying something. I didn't know what. I thought it was the years. It might still be the years. It might be." He folded the photograph and put it back in his pocket. "But whatever you did in that room today, he hasn't been that calm in months. Not since before the decline started." She didn't have anything to say to that, so she didn't say anything. "I need to ask you something," Farr said, "and I need you to answer me straight." "Okay. Is there any reason, any professional or personal reason, why you couldn't be present for his imaging session this afternoon, as a secondary support contact?" She thought about Holt. She thought about the orderly and the documentation of time delays. She thought about the math of what it would cost her to say yes and the math of what it would cost Rook if she said no. "No reason," she said. Farr nodded. He stood up. "I'll clear it with Moss." "Colonel?" He stopped. "Whatever Moss finds in the imaging. How bad are we talking, realistically?" He looked at her with the steadiness she'd come to recognize as his default register. Not distance, not hardness, just the particular composure of someone who'd learned to hold difficult information without letting it hold them. "Realistically," he said, "we're talking about the last chapter. How long that chapter is, that's what Thursday tells us." He left. Nora sat with her sandwich for another minute, then threw most of it away because she still didn't taste it. She didn't make it to the imaging session. Holt found her at 2:15 in the corridor outside the radiology suite and intercepted her with the specific energy of a man who had been waiting for this moment and had prepared for it. Voss. He positioned himself not quite in her path, but close enough that stopping felt required. "We need to talk about this morning. I'm due in radiology and I know where you're due. That's what we need to talk about." He lowered his voice, which was his version of making a conversation private. "You're a trauma nurse. You have a defined role in this facility, and that role has very clear parameters. Dr. Moss requested my assistance. Dr. Moss made an in-the-moment call under pressure. That's different from a sanctioned scope of work, and you know the difference." He paused. "I've been reviewing the incident documentation from this morning. The time delay from initial presentation to evaluation commencement is going to generate a report. That's standard protocol." "I understand. What you may not understand is how that report reads, and what it reads like right now is a staff member without appropriate credentials inserting herself into a military veterinary assessment and delaying the process." She looked at him. "I was asked to help." "You were asked as a rhetorical gesture. I made that suggestion with the expectation—" He stopped, recalibrated. "The point is that you took an authorization that wasn't clearly given and ran with it, and now we have a colonel on the record saying his dog needs a nurse present for imaging, which is not a thing, Nora. That's not a thing that exists in any protocol." He'd used her first name. He almost never used her first name. It meant he was trying to soften something. "So what are you telling me?" she asked. "I'm telling you to let Moss handle the imaging. I'm telling you to return to your assigned duties and let this morning be a one-time situation that resolved and moved on." He said it with the even tone of someone delivering news that was unpleasant but inevitable. "And I'm telling you that if Colonel Farr requests your involvement again, the appropriate response is to direct him to me." She could feel very clearly the shape of what was happening. Not a reprimand, not yet. A fence. a perimeter being drawn in advance of something he anticipated. "Is that an order?" she asked. "It's guidance," he said. "Strong guidance." She nodded once, turned and went back the way she'd come. She didn't go back to her assigned duties. She went to the stairwell, stood in it for 60 seconds with her hands pressed flat against the cool concrete wall, and breathed. Then she took out her phone and sent Far a text. Held up. "Can't make radiology. Moss is excellent. He'll be okay." His reply came in 30 seconds. "Understood. Thank you for this morning." She put her phone away and went back to work. The imaging results came back on Thursday, as Moss had said they would, and they were not good. Nora wasn't in the briefing. She had no standing to be in the briefing, and after Holt's corridor conversation, she wasn't going to push for it. But Farr found her at the end of her shift, in the parking structure on level 2, next to her car. She wasn't sure if he'd waited or if it was coincidence, but from the set of his jaw, she guessed he'd waited. "Bilateral hip dysplasia, moderate to severe on the left," he said without greeting her. "Early degenerative changes in the lumbar spine. Mild optic nerve irregularity that Moss wants a specialist to look at. Could be early SARDs, could be something else." He said it the way you recited a list you'd memorized, because memorizing it was easier than processing it. "She's recommending a pain management protocol and reduced activity. No further operational deployments. Formal retirement to be completed within 30 days. He was already retired, Nora said. Formally retired. With placement. He paused. "They'll find him a home. It's a program. He'll be placed with someone." He didn't say a good home because he was too careful with language to promise things he couldn't guarantee. "Are you his placement option?" she asked. Something crossed his face. "My situation doesn't accommodate a dog his size. I travel 40% of the year. The apartment—" He stopped. "I've been his handler for 6 years. I'm not the right placement, which is something I've been telling myself for 3 months, and I still don't fully believe." She didn't say anything. The parking structure was cold in the way parking structures were always cold. That particular underground temperature that belonged to no season. "There's a placement review next week," Farr said. "At Fort Carver, which is where the Ridgeline program is still operating. They'll assess applicants, match him." He looked at her directly. "I thought you should know that." She understood what he was telling her. She also understood everything he wasn't saying. That placement reviews had criteria, that applications required background checks and home assessments, and a whole bureaucratic process that took time. They might not have in ways she couldn't fully calculate, that the obvious thing he was gesturing toward was complicated by approximately 47 factors she hadn't sorted through yet. "I'll think about it," she said. "That's all I'm saying." He turned to go, then stopped. He was calm in the imaging. "Moss said to tell you, whatever you did Tuesday stayed with him." He left. Nora got in her car and sat in it without starting it for a while. She was thinking about the broken fence slat in the photograph. She was thinking about a year of her life that she'd spent doing something she'd never told most people about, in the gap between one version of herself and another. She was thinking about a 14-month-old dog who'd bitten her by accident and then sat outside a bathroom door waiting to be sure she was still there. She was thinking about what Holt's strong guidance would look like if she submitted a placement application to a military program that would require disclosure to her employer. She was also thinking, and this was the thought that sat underneath all the others like a low-frequency hum, that the 3 months of Rook's decline matched up almost exactly with 3 months ago, when she had first started suspecting that the trauma wing's medication inventory logs were off. Not dramatically off. Subtly off. The kind of variance that could be explained as clerical error if you squinted at it from the right angle, and that stopped looking like clerical error if you looked at it straight on. She hadn't done anything with that suspicion yet because she hadn't had enough information and because she'd been waiting for the moment when the information would be solid enough to matter. That moment, she was becoming increasingly uncomfortable with, was getting closer. The logs were stored in the medication management system, a software platform called MedVault that Hartwell had implemented 2 years ago. Every controlled substance in the trauma wing was supposed to be documented in MedVault with a dispensing record, a patient record match, and a witness signature. The system was supposed to make diversion impossible. Most systems like it did, when people used them honestly. The problem was that MedVault had a reconciliation window, a 48-hour period during which inventory discrepancies could be corrected and rebalanced without generating an automatic flag. It was built into the system for legitimate reasons: late documentation, transfer delays, the ordinary bureaucratic friction of a busy medical facility. But a reconciliation window, if you knew it was there, was also a structure you could work inside. Nora had started noticing the pattern in January. Small variances, a milligram here, 2 milligrams there, in the Schedule 2 documentation. Always within the reconciliation window, always corrected before the flag threshold, always in the same 3-day rotating cluster that corresponded to a specific combination of shift assignments. She'd built a spreadsheet on her personal laptop. She'd checked it 6 times looking for an alternate explanation and found partial ones, legitimate documentation lag, legitimate transfer timing, but not enough to account for everything. She hadn't gone to Holt because the shift assignments in the cluster included Holt's direct reports, and twice, peripherally, Holt himself. She hadn't gone to pharmacy because pharmacy was downstream of the MedVault system, and whoever was doing this understood MedVault well enough to navigate around its flags. She hadn't gone to anyone. She'd been building the picture slowly, carefully, and she'd been doing it alone because that was the only way to do it safely, and she'd been trying to figure out what the right move was when you were a trauma nurse without credentials, who had noticed something that people with credentials hadn't, or had, and hadn't done anything about. And now she was sitting in a parking structure thinking about Rook's hip and Farr's face and the shape of a broken fence slat in a 7-year-old photograph. And she was thinking, the timing is not a coincidence. Not Rook's timing. His physical decline was what it was. But Farr's timing. The fact that his evaluation request had been filed in January when the pattern had started, and that he'd pushed for an on-site evaluation rather than the usual satellite vet, and that he'd specifically requested Hartwell Defense Medical Center out of the 3 facilities that served the Calverton corridor. She could be wrong. She was aware that she could be wrong. Pattern recognition was a survival skill and also a liability. The brain that was good at connecting dots was also capable of connecting dots that didn't belong to the same picture. But Colonel Desmond Farr had taken a photograph out of his pocket and put it on a table between them, and the photograph had been handled enough times to curve at the edges, and the way he'd looked at her when she said she was going to think about it was not the look of a man who was making a suggestion. She started her car. She needed to look at the spreadsheet again. Whoop. The spreadsheet had 43 entries. By Friday morning, it had 47, and the pattern in the new 4 was tighter than anything she'd seen before. Not a variance within the reconciliation window, but a clean swap. An equivalent weight substitution logged within a 30-minute period that corresponded to a shift handover, which was when MedVault's real-time monitoring had a documented 8-minute sync lag. 8 minutes. Someone had mapped the 8-minute sync lag. That was not an accident. That was not clerical error. That was not anything that had an innocent explanation. Her hands were steady on the keyboard because she'd taught herself over years to keep her hands steady when her chest wasn't, and right now her chest was doing something that she needed to hold away from her hands. She saved the spreadsheet to 2 separate drives, printed a copy, and put the printed copy in the false bottom of her nursing bag that she'd installed when she was doing a different kind of work and had never removed because old habits made sense until they didn't. Then she went to her shift. Holt was in a meeting when she arrived, which was good. She moved through the morning on autopilot, 2 post-surgical patients, a transfer, a wound assessment on a veteran with a complicated healing timeline. And she was competent and present, and nobody who looked at her would have known she was running 2 parallel processes. The second process was figuring out who she could take this to. Not Holt. Not anyone downstream of Holt. Not hospital administration, because hospital administration and Holt's department had a documented relationship, and she had no way to gauge how far the water had been poisoned. She needed someone external, someone with actual investigative authority who wouldn't require her to trust the institution to investigate itself. She was thinking federal. She was thinking specifically about the fact that Hartwell Defense Medical Center had federal contracts, which meant that medication diversion from its controlled substance inventory was not just a state licensing board issue. It was a federal crime. She was thinking, with a clarity she would have preferred not to have, about Colonel Desmond Farr and the way he'd looked at her across that table and said, "I thought you should know that." She was on her lunch break, eating, actually, because she'd learned not to miss meals on high-stress days, when her phone buzzed. Not a text. A call. From a number she didn't recognize, Virginia area code. She picked up. "Nora Voss?" A woman's voice, precise, unhurried. "Yes?" "My name is Special Agent Diane Truax. I'm calling from the Department of Defense Inspector General's office. A brief pause, deliberate. I understand you work in the trauma wing at Hartwell Defense Medical Center. Nora set down her fork. We've been conducting a preliminary review of inventory management irregularities at several federally contracted medical facilities in the Mid-Atlantic region. Another pause. Your name has come up in a context I'd like to discuss with you. I was wondering if you might have time for a conversation. Nora looked at the wall across from her. Thought about 47 entries. Thought about an 8-minute sync lag. Thought about a photograph curled at the edges. Yes, she said. I have time. Good. Truax's voice didn't change temperature. I'd like to do this in person, somewhere off-site. Would Monday work? Monday works. I'll text you a location, Ms. Voss. The agent paused a final time, and when she spoke again, there was something in her voice that was almost but not quite reassurance. Don't discuss this call with anyone at your facility. Not yet. The line went dead. Nora sat very still in the break room with her phone in her hand, and somewhere 2 floors below her, in the lower-level veterinary holding area, a retired military working dog with early hip dysplasia and a 7-year-old memory was lying on a padded mat waiting, with the particular patience of a trained animal, for something he had already decided was coming. And 2 floors above her, in the office with the good window that looked out over the Calverton skyline, Garrison Holt was closing a door. She didn't sleep well Sunday night, which she'd expected. She lay in her apartment with the windows cracked and listened to Calverton doing what mid-sized cities did at 2 in the morning. The distant percussion of traffic, a siren that started and stopped, someone's music filtering down from an upper floor. And she ran through the Monday meeting the way she ran through difficult procedures before she performed them. Not rehearsing exactly. More like clearing the static so that when the moment arrived, she'd have room to actually think. Special Agent Truax had texted a coffee shop address in the Glenport neighborhood, 20 minutes from Hartwell, at a time, 8:00 a.m. That meant Nora would need to arrange a shift coverage swap, which she'd done by trading with a colleague named Priya without giving a reason, because Priya was the kind of person who didn't require one. She brought the spreadsheet. Printed copy in the nursing bag, digital copies on both drives in her jacket pocket. She'd also written by hand on a legal pad a clean timeline, 47 entries cross-referenced with shift assignments, dates, and the specific MedVault reconciliation windows involved. The handwritten version was slower to read but harder to dismiss. Numbers on paper had a different weight than numbers on a screen. Truax was already there when she arrived. Mid-50s, compact, wearing civilian clothes that were clearly deliberate, dark slacks, plain blazer, nothing that announced itself. She had a coffee in front of her and a leather folio open on the table. She stood when Nora came in, which Nora hadn't expected, and shook her hand with a grip that was businesslike without being aggressive. "Thank you for coming," Truax said. "Thank you for calling," Nora said, and meant it. They sat. Truax didn't produce credentials or explain her authority or do any of the things that television suggested agents did at the start of a conversation. She just looked at Nora with the level attention of someone who had learned to extract information through patience rather than pressure. "Before we start," Nora said, "I want to know how my name came up." Truax considered this. "I can tell you that we've been building a picture at several facilities for 8 months. Hartwell has been in that picture for 6. When we get to the point in a review where we need a current internal source, someone who's present, who has access, who hasn't been compromised, we develop a list of names. Yours was on the list." Developed how? Personnel records, performance reviews, the particular pattern of someone who's been raising procedural concerns and documentation without getting traction. A slight pause. You filed 3 internal incident reports last year. 2 were closed without action. 1 was reclassified as a training matter. Nora hadn't known anyone outside Hartwell had access to those. She filed them because the protocol required it, and because she understood that a paper trail was only useful if the paper actually existed. She hadn't expected them to surface like this. "What are you looking at?" she asked. Medication diversion from the controlled substance inventory, specifically Schedule II opioids, oxycodone and hydromorphone, primarily. We believe the diversion has been ongoing for between 14 and 18 months across 3 federally contracted facilities. Truax's voice didn't change register when she said it. "At Hartwell, we have circumstantial evidence of a structured internal operation. What we don't have yet is the internal documentation that ties the timing to specific personnel. Nora reached into her bag and put the printed spreadsheet on the table. Truax looked at it without touching it. Then she looked at Nora. "How long have you been building this?" she asked. "Since January. I started noticing the MedVault variance pattern in the reconciliation window data. The sync lag exploitation. I documented that separately." She slid the handwritten timeline across. "The personnel cross-reference is on page 4. I was careful not to make direct accusations in the documentation. I listed shift assignments and flagged the overlap. The conclusion is yours to draw." Truax picked up the timeline. "Read it." Her face did very little, which was in itself a form of information. "The sync lag documentation," she said. "Walk me through that." Nora walked her through it. Truax listened without interrupting, asked 2 precise follow-up questions, and then wrote something in her folio that Nora couldn't read from the angle she was sitting. "This is useful," Truax said. She said it the way people who measured their words carefully said things were useful, meaning significantly more than the word itself carried. "I need to know something," Nora said. Truax waited. "One of the names in the shift overlap, Garrison Holt." She said it flat, no editorializing. "He's the department supervisor. He's been managing my incident reports. He's been present in ways that have limited my ability to escalate this internally." "I know who Garrison Holt is." "Is he a target or is he a peripheral?" Truax closed her folio. "Ms. Voss, at this stage of the review, I can't share that with you. What I can tell you is that your documentation is going to accelerate our timeline significantly." She looked at her levelly. "I also need to tell you something that I need you to hear carefully." "Okay. When we move on this, and we will move, we'll need you to continue your normal routines at the facility. Don't change your behavior. Don't avoid Holt. Don't start documenting things differently. The moment behavior changes inside that building, we risk tipping the operation before we have what we need." "How long?" "Weeks, not months." Nora nodded. "And when it moves, what happens to the people who've been covering for it? Not the people running it, the people who look the other way." Truax's expression shifted by about 3 degrees. "That depends on how proactive they choose to be between now and when we move." She picked up her coffee. "Is there someone specific you're thinking about?" "Not yet," Nora said. She wasn't sure that was entirely true. She was back at Hartwell by 10:30, which put her in the trauma wing in time to cover the tail end of a morning that had apparently been busy. A multi-vehicle accident had produced 3 admissions overnight, and the wing was running at capacity, which meant everyone was behind and nobody had attention to spare for whatever Nora Voss had been doing with her morning. Holt passed her in the corridor at 11 without speaking. His attention was on a tablet, and he moved with the preoccupied energy of a man managing 3 things simultaneously, and nothing in his manner suggested he knew or suspected anything. He looked exactly the way he always looked. That was either reassuring or the most dangerous possible thing. She picked up a patient and put her head down. The next 9 days were the longest 9 days of her professional life, and they were also, paradoxically, the most ordinary. She did her job. She was good at her job. She kept her documentation clean and her behavior flat, and her conversations with Holt exactly as transactional as they'd always been. Rook's placement review happened on the 2nd Wednesday. She knew because Farr had sent her a brief text. "Review complete. Good outcome. Details when I can." And she'd sent back a thumbs up and not pressed him, because she could feel through the brevity of his message that he was managing something himself. On Thursday of the 2nd week, the medication variance pattern escalated. She caught it at 6:45 a.m. during a pre-shift walkthrough, not in MedVault, which she'd stopped accessing directly to avoid leaving a footprint, but in the physical inventory reconciliation log that the night shift completed by hand. A discrepancy she would not normally have checked. A discrepancy that was larger than anything she'd documented before. Not a milligram variance, not a small-scale swap, but a 60-unit shortfall in the hydromorphone tray that had been papered over with a bulk reclassification notation that did not correspond to any patient record she could match in 5 minutes of checking. 60 units. That wasn't routine diversion. That was someone either panicking or accelerating, and neither option was good. She photographed the log page with her phone, went to the locker room, and sent it to a number Truax had given her for exactly this kind of communication. Then she went back to work. Truax's reply came during her lunch break. 3 words. Stay the course. She stayed the course. The crisis broke on a Friday, and it broke from a direction she hadn't anticipated. It started with a patient, a veteran named Marcus Odell, 41, admitted 2 days prior with a traumatic lower limb injury sustained during reserve training. He was on a post-surgical pain management protocol, which meant scheduled hydromorphone doses at set intervals, logged and witnessed per protocol. At 2:15 p.m. on Friday, Nora was doing his 2 o'clock p.m. check, 15 minutes late because the wing was short-staffed, and Marcus Odell told her he hadn't received his noon dose. She checked the chart. The noon dose was logged, witnessed by a tech named Sully Brennan, patient initials in the confirmation field. "Did you sign this?" she asked, showing him the tablet. He looked at it. "No." She kept her face neutral. "Okay, I'm going to look into that. In the meantime, how's your pain level right now?" 7, maybe 8. His jaw was tight. "I figured it was just delayed." It hadn't been delayed. It hadn't been administered. It had been logged as administered, and the actual dose had gone somewhere else, and the patient's signature in the confirmation field had been forged. That was not careful, systemic diversion working inside a reconciliation window. That was sloppy. That was someone taking shortcuts that left a direct patient harm trail, which was a different order of problem than what she'd been tracking. She administered a corrected dose with a witness and documented everything in real time, time-stamped, with her own name attached. Then she went to the nearest supply room, closed the door, and called Truax. "Patient impact," she said when the call connected. "Direct. I have a forged administration record and a patient who did not receive his scheduled dose. Hydromorphone. He's stable, but he's been undermanaged for 2 hours." A pause. Shorter than she expected. "Is the patient safe right now?" "Yes." I corrected it. "Is the forged record still in the system?" "Yes." I documented my correction as an addendum. The original record is still there. "Don't alter it. Don't flag it internally. Go back to your patient." Truax's voice was measured, but the speed of her responses had changed. "Miss Voss, are you somewhere private right now?" "Supply room." "Good. Listen carefully. We're moving the timeline up. I need you to be at work tomorrow morning. Regular shift. Don't call in, don't request a transfer, don't do anything that changes your footprint." "What's happening tomorrow?" "I can't tell you that specifically. What I can tell you is that you've been doing exactly the right things, and I need you to keep doing them for approximately 16 more hours." A brief pause. "Can you do that?" She thought about Marcus Odell with his jaw tight saying 7, maybe 8. She thought about 47 entries and 60 missing units and 8 minutes of sync lag that someone had turned into a tool. "Yes," she said. "Go be a nurse," Truax said, and ended the call. She was a nurse for the rest of the Friday shift, and she was a nurse through a dinner she cooked and ate, standing at her kitchen counter, and she was a nurse, in the sense of being functional and present, through a Friday night that was even less sleep than Sunday had been. She kept coming back to the forged signature, the patient's initials in a confirmation field they'd never touched. That was the line that changed everything, because up until that record existed, what she had was financial crime, regulatory crime, serious, consequential, but abstract. The patient with the forged signature made it concrete in a way that landed differently in the body. She was at Hartwell at 6:30 Saturday morning. The wing was on weekend staffing, leaner, slower in the early hours, the overnight crew coming off a quiet night. She changed into scrubs, drank the terrible coffee, and began her check of the medication card as though this were any other Saturday. At 8:20 a.m., 4 things happened inside a window of about 3 minutes. The first was that she heard voices in the administrative corridor, the kind of voices that didn't belong to the weekend skeleton crew, too many of them, too purposeful. The second was that her phone buzzed once with a single text from Truax, "In the building." The third was that Sully Brennan, the tech whose name was on the forged administration record, walked past the nurse's station moving fast, headed toward the east exit, carrying his bag with the particular energy of someone who had decided they were done being somewhere. The fourth was that Garrison Holt came out of his office at the end of the corridor, and for the first time in the 4 years Nora had worked under him, he looked like he didn't know what to do next. She stayed at her cart. She kept moving. She did the thing Truax had told her to do, which was to maintain her footprint, and she did not look at Holt directly, and she did not follow Brennan toward the exit, and she did not go into the administrative corridor. But she heard it. Not clearly. Walls and distance made it impressionistic. But she heard the unmistakable register of federal authority entering a space that had been operating as though it wasn't being watched. She heard Holt's voice spike once and then flatten. She heard someone else speak in the tone that agents used when they were past the introduction stage. Brennan didn't make it to the east exit. She heard that from one of the weekend nurses, who came back from the break room 20 minutes later looking like she'd seen something she was still assembling an explanation for. "There are people stopping Sully in the lobby," the nurse said, "like official people. I don't know what—" "Keep working," Nora said. Not harshly, just steadily. The nurse kept working. At 9:45, Truax appeared in the doorway of the trauma wing. She was in the same kind of civilian clothes as Monday, and she had two people with her, a man and a woman, both in the particular attire that read as federal even when it wasn't designed to announce it. She scanned the wing until she found Nora and then walked toward her with the unhurried pace of someone who had the room. "Ms. Voss," she said. Not a greeting, a confirmation. "Agent Truax." Truax glanced at the nurses' station around them. The weekend nurse, an orderly at the far end, the general Saturday morning configuration of a trauma wing. She made a decision. "I need a few minutes. Is there somewhere?" "Supply room," Nora said. They went to the supply room. Truax's manner was different than Monday. Not warmer. She wasn't a warm person in a demonstrative sense, but less careful. The particular carefulness of a person managing an ongoing operation had shifted into something else. "We've executed search warrants on the administrative offices, the pharmacy, and 3 personnel vehicles in the lot," she said. "Brennan is being detained. There are 2 other individuals currently being interviewed. The warrants also cover digital records from MedVault. We have forensic personnel accessing the system now." "Holt," Nora said. Truax looked at her. "Holt is being interviewed. He's not under arrest at this stage." "At this stage." "At this stage." She held Nora's gaze. "Your documentation, the spreadsheet, the timeline, the forged administration record you flagged yesterday, that's been formally entered into the federal case record. It's on file as a voluntary cooperating submission." She paused. "You're a witness, Ms. Voss. That's a protected status." Nora absorbed this. "What does that mean practically?" "It means no one in this facility can take adverse action against you related to this matter without federal exposure. It means your incident reports from last year are now part of a retaliation pattern that's documented." Truax said it plainly, not triumphantly. "It means you did the right thing, and the thing you did is now on record." Nora leaned against the shelving unit behind her. She was tired in a way she couldn't locate specifically. It was distributed, cellular, the kind of tired that came from running 2 parallel processes for 9 days while keeping her face neutral. "How far does it go?" she asked. "The network, the other facilities." "Further than Hartwell," Truax said. "That's as specific as I can be right now." "Is Rook's imaging visit in January?" She stopped, tried to reframe it. "Colonel Farr's request to evaluate his dog here, specifically, was that part of the review?" Truax was quiet for exactly the right length of time. "I can't answer that." Which was, in its own way, an answer. Nora nodded slowly. Farr had chosen Hartwell out of 3 available facilities. He'd pushed for an on-site evaluation. He'd put a photograph on a table and told her about a placement review, and said, "I thought you should know that," in the tone of a man communicating more than his words were carrying. She wasn't sure what to do with all of that. She filed it in the same place she'd filed other things she didn't have a category for yet. "I need to get back to my patients," she said. "Of course." Truax stepped back. "There will be a formal interview, voluntary, at your convenience sometime in the next 2 weeks. We'll contact you with scheduling." She reached the door, then stopped with her hand on the frame. "Ms. Voss, the patient record, the forged signature. You corrected it. You documented it in real time. That single action is going to be material to one of the charges." She said it without fanfare. "I wanted you to know that." She left. Nora stood in the supply room for 30 seconds. Then she went back to her cart and resumed the medication round she'd interrupted 80 minutes ago because Marcus Odell's 10:12 a.m. check was coming up, and he'd been managed badly enough for 2 hours yesterday without adding more time to it. The rest of Saturday moved with the surreal quality of a day that was objectively significant and functionally mundane simultaneously. Federal personnel came and went through the administrative wing. Word spread through the weekend staff in the fractured, half-accurate way that word always spread in medical facilities. A version involving the pharmacy, a version involving something financial, a version that was almost entirely wrong but directionally correct. Nobody approached Nora directly, which meant either that her connection to what was happening wasn't visible or that people were processing and hadn't gotten to her yet. Holt left the building at 11:30. She saw him through the glass panel of the corridor door, moving through the main atrium with the deliberate posture of a man trying very hard to look like he was leaving under his own authority, accompanied by two people she recognized as federal from the morning. He didn't look toward the trauma wing. She wasn't sure if that was deliberate. She went back to room 114 and checked on her patient, who was asking about the men in suits he'd seen through his window. "Administrative review," she said. "Not about your care." "Everything okay?" She looked at him. "It's going to be," she said. At 3:00 p.m., she was taking a 5-minute break at the nurse's station, actually sitting, actually breathing, when her phone buzzed. Far. Not a text. A call. She stepped into the corridor and answered. "I heard something happened at Hartwell today," he said. "News travels. Military networks are fast." A pause. "Are you all right?" "Yes." She thought about it. "Actually, yes." "Good." He was quiet for a moment. "Rook's placement was finalized yesterday," he said. "I wanted to tell you before it became official. The review approved a home assessment. The applicant passed. He moves at the end of the month." Something pulled in her chest. "Who's the placement?" The pause was a fraction too long. "Colonel," she said. "The applicant lives alone," Farr said. "Single occupancy residence. Stable employment. Documented history with the Ridgeline program." Another pause. "Clean background. No flags." She was very still. "The applicant's name on the formal record," Farr said, "is Nora Voss." The corridor was empty around her. Doors of the trauma wing, she could see the Saturday afternoon configuration of the place where she'd spent 4 years doing work that nobody had particularly noticed. "You filed it," she said, "without telling me." "I filed a preliminary inquiry, on your behalf, based on the conversation in the parking structure." His voice was careful. "The formal application required your documentation and consent, which the Ridgeline office contacted you about." She thought back. 2 weeks ago. An email she'd half-registered as routine from a Fort Carver administrative address. She'd thought it was a survey. "That email was a consent and documentation request," Farr confirmed. "You responded within 48 hours. The review board counted it as an active application." She had no memory of reading it carefully enough to understand what she was consenting to. She'd clicked confirm on what she thought was a program feedback form at 11:30 at night after a 9-hour shift. "That is," she started, then stopped. "That is either the most efficient bureaucratic process I've ever encountered or a mild violation of informed consent." "Mild," Farr agreed. He said it without apology, but also without complete immunity from it. "He's coming home," she said. She heard how it came out. Not a question, not a performance of anything. Just a fact arriving. "End of the month," Farr said. "Pending your home assessment, which is scheduled for Wednesday," she said, because apparently she had confirmed a Wednesday appointment in the same email she'd thought was a survey. "Wednesday," Farr confirmed. She stood in the corridor for another moment, phone to her ear, and looked at the trauma wing through the glass. "Colonel," she said, "did you know about Truax when you chose Hartwell for the evaluation?" The silence on the line had a specific texture, not avoidance, not deflection, consideration. "I knew that Hartwell was on a federal review list," he said. "I knew that an internal source would be valuable to that review. I knew that the source would need to be someone who was already tracking the problem, who had the discipline to do it quietly, and who had protected status standing once the operation moved." He paused. "I didn't know it was going to be you specifically until Rook walked across that room." She absorbed this. "You used a dog as reconnaissance." "Rook made his own decisions," Farr said. "He always has." She laughed once, involuntarily, And it surprised her because nothing in the last 9 days had felt remotely like something you could laugh at. It came out a little rough. She let it. "I'll be at the home assessment Wednesday," she said. "I know," he said. She ended the call. She went back to the nurse's station, sat down, and pulled up Marcus Odell's afternoon chart to prep for the 4:12 p.m. round. The fluorescent lights did their flicker. The elevator on the east end took its extra 45 seconds. Someone's gurney wheel needed oil. And somewhere in the administrative wing of Hartwell Defense Medical Center, in an office with a good window that looked out over the Calverton skyline, the door that Garrison Holt had closed on Saturday morning opened again, this time from the outside. And inside it, sitting on the desk, was a laptop that forensic personnel had just completed imaging. And on that laptop, buried under 3 nested folders in a personal directory, was a file that contained 18 months of records that Holt had been certain no one was ever going to find. The file was named Reconciliation Backups. The irony of that was going to land differently on everyone who read it. The file named Reconciliation Backups was 847 megabytes. That number circulated through the federal team by Monday morning, and it reached Nora third hand through a source she hadn't expected, Dr. Petra Moss, who called her at 7:15 a.m. while Nora was still in her car in the Hartwell parking structure, engine running, coffee in the cup holder going cold. "I'm not supposed to know this," Moss said, which was her version of a preamble. "But I have a colleague in the IG's forensic unit, and she mentioned the size of the file recovery. 847 megabytes of structured data is not a backup. That's a ledger. That's 18 months of parallel bookkeeping. Moss, I'm not asking you to confirm anything. I'm telling you what I know so you're not walking in there blind." A pause. Holt had a secondary system, not MedVault. Something he built himself or had built, a shadow reconciliation tool that cross-referenced the actual inventory against the falsified MedVault records. He was tracking his own diversion, making sure the numbers matched from both sides. Nora sat with this for a moment. "That's meticulous," Moss said, "and completely damning. You can't claim accidental variance when you have a private file that documents exactly how much you took and exactly how you covered it." Another pause. "I also want to say something else, and then I'm going to hang up and we're not going to discuss this specific conversation again." "Okay." "Your incident reports, the 3 that were closed or reclassified." Moss's voice was controlled, but something was working underneath it. "I was on the quality review committee when 2 of them came through. I read them. I flagged one for escalation and was told by Holt that the matter had been reviewed and resolved." She stopped. "I should have pushed harder. I didn't. I want you to know that I know that." The parking structure was cold and gray around her. Somewhere above, the facility was already in motion. The first shift arriving, the overnight staff finishing their handovers. The ordinary machinery of a hospital morning running on schedule in a building where the previous Saturday's events were still settling into the walls. "I appreciate you telling me," Nora said. "Go be careful," Moss said, and hung up. Nora sat for another minute. Then she picked up her coffee, drank what was left of it cold, and went inside. The trauma wing on Monday felt like the day after a storm. Not calm exactly, but post-event. The kind of atmospheric shift that happens when something large has passed through and the air hasn't quite redistributed yet. People were working, patients were being managed, the morning rhythm was intact. But there were gaps. Sully Brennan's name wasn't on the assignment board. The office at the end of the corridor that had been Holt's showed a closed door and a notice from hospital administration about interim coverage. 2 of the pharmacy techs who'd been on the rotating shift cluster were absent, and nobody was explaining why in any official way, which meant everyone was explaining it in every unofficial way simultaneously. Nora moved through her morning like she always moved through her morning, head down, thorough, present with her patients in the way that required actual presence rather than its performance. Marcus Odell was improving. His wound site was clean, his pain was being managed on a corrected protocol, and he'd started physical therapy consults. He asked her on Monday, as she was doing his morning assessment, whether the thing with the suits over the weekend had anything to do with his missing dose on Friday. She looked at him. He was 41 and direct, and had the particular economy of language that came from years of working in environments where clarity mattered more than diplomacy. "It's connected," she said. "I can't give you details, but yes." He nodded once. "You fixed it." I corrected the immediate problem, yes. No. He held her gaze. I mean, you fixed it, the whole thing, didn't you? She didn't confirm it, and she didn't deny it. She finished his assessment, recorded his vitals, told him therapy was at 2, and left the room. In the corridor, she stood for a second with her back to the wall and breathed, because nobody was watching that particular stretch of hallway at that particular moment, and she needed the second. She took it. Then she kept moving. The formal interview with Truax happened on Tuesday at the same Glenport coffee shop, and it ran 2 hours and 40 minutes. Truax had a colleague with her this time, a younger agent named Pollard, who took notes and asked precise follow-up questions and had the focused, slightly exhausted energy of someone who had been working this case across 3 facilities for 8 months and was now in the phase where the work got harder, not easier, because evidence had to be built into something a prosecutor could use. They went through everything: the spreadsheet, the timeline, the sync lag documentation, the forged administration record, the 60-unit shortfall. They went through her incident reports in detail, what she'd observed, how she'd framed it, who had received it, what the response had been. They went through her interactions with Holt over 4 years, which took longer than she expected because there were more of them than she'd consciously cataloged. And laying them out in sequence was different from carrying them in the distributed way she'd been carrying them. At one point, Pollard asked, "Was there ever a direct conversation with Dr. Holt about the medication inventory specifically?" "Not directly," she said. "He made a comment in November. I documented it in my personal notes about MedVault being an imperfect system. He said specifically that any system that generates as many false flags as MedVault does was going to create documentation burden without proportional safety benefit." Pollard looked up from his notes. "He said that to you?" "In the corridor, after a staff meeting. I wrote it down that night because it struck me as an odd thing for a department supervisor to say about a safety system." "That's in your personal notes," "which I brought." She slid a second document across the table, a printout of the relevant pages, dated and time-stamped by the note application on her phone. Truax and Pollard exchanged a look that communicated something she wasn't fully privy to but understood directionally. "Ms. Voss," Truax said, "I want to be direct with you about where this case is. We have enough to charge Brennan. He's already in conversation with the U.S. Attorney's Office about a cooperation agreement. The 2 pharmacy techs are facing separate charges. The shadow ledger recovered from Holt's laptop is being analyzed by a forensic accountant, and we expect the full scope of the diversion to be quantifiable within 2 weeks. She paused. "Holt's attorney has been in contact with the U.S. Attorney's Office. He's not cooperating at this time." "What does not cooperating at this time mean for the timeline?" "It means the case builds around him rather than with him. It takes longer, but in this specific situation, with the documentary evidence we have, longer doesn't mean weaker." Truax folded her hands on the table. "What it means for you practically is that you're going to be living in the middle of this for a period of time while the investigation continues. You may be called as a witness in grand jury proceedings. Your facility is under interim leadership, which creates its own environment." "I know how to work in complicated environments," Nora said. Truax looked at her. Something in her expression shifted. Not warmth exactly, but a recognition of something. "Yes," she said. "You've demonstrated that." After the interview, standing on the sidewalk outside the coffee shop in the particular February cold of a Virginia morning, Nora called Farr. He picked up on the second ring. "Interview's done," she said. "How was it?" "Long, thorough." She watched a car pull out of this parking lot across the street. "Holt's not cooperating." "He will," Farr said. "How do you know?" "Because the ledger is 847 megabytes." He said it without particular inflection. A man who builds a shadow accounting system that detailed is a man who needs to control information. When he loses control of it, he looks for a new way to be in control. Cooperation with the prosecutor is the only lever he has left. She thought about the jaw calculation, cost versus benefit, always cost versus benefit. "Yeah," she said, "you're probably right." "Wednesday," he said, "the home assessment. I'll be there." She walked to her car in the cold and thought about Rook on a padded mat 2 floors below the chaos of the previous Saturday, patient and waiting, and about a photograph handled enough times to curl at the edges, and about the strange, non-linear way that some things found their way back. The home assessment on Wednesday was conducted by a Ridgeline program representative named Everett Kwan, civilian contractor, mid-50s, with the thorough and professionally neutral manner of someone who had done a great many of these and had learned that the assessment was only partly about the physical space. He walked through her apartment methodically. The square footage, the yard access question, which she didn't have a yard for and which he noted without apparent judgment, the sleeping arrangements, the routine flexibility, the proximity to green space. He asked about her schedule. She told him, including the ongoing federal witness status, which she disclosed because Ridgeline's clearance requirements mandated it, and because she wasn't going to build the next chapter on an omission. Kwan wrote it down. "That's an unusual circumstance," he said. "Yes. It doesn't disqualify an applicant. It's a flag for our review board." He made a note. Colonel Farr submitted a character reference. "I know. Dr. Petra Moss also submitted one, unsolicited, 2 days ago." Nora hadn't known that. She took it without showing much. Kwan closed his folder. "I'm going to be direct with you, Ms. Voss. Rook is a complicated placement. His physical needs are going to increase as the dysplasia progresses. He's going to need regular veterinary management, a modified exercise regimen, and an owner who understands the difference between a retired working dog's behavioral needs and a pet's." He looked at her steadily. "He's also a dog who has spent 6 years in a highly structured environment and is now facing a transition that, at his age and in his condition, carries real risk. Dogs his age, in his circumstance, don't always adapt." "I know," she said. "You spent 11 months with him when he was 14 months old. He remembers you, which is documented and unusual, but he's not the same animal." "Neither am I," she said. Kwan looked at her for a moment. Then he made a final note, closed the folder, and stood. "The board meets Friday," he said. "You'll have a decision by end of day." He left. She sat in her apartment in the Wednesday afternoon light and looked at the space where a large dog would sleep, and at the corner near the window where the afternoon sun hit the floor in a way that a dog would find within the first week, and at her own hands, which were still steady because she'd taught herself to keep them that way. The decision came Thursday, not Friday. An email from the Ridgeline Administrative Office at 4:17 p.m., which she read on her phone in the hospital parking structure, engine running, the same spot she'd been in on Monday morning when Moss had called. Application approved. Placement confirmed. Transfer scheduled. February 28th, 1400 hours, Hartwell Defense Medical Center, veterinary intake. She sat with it. Then she texted Farr. Approved. His reply was immediate, a single period, which she understood because some things didn't need words and he was a man who knew the difference. She went home. The next 10 days moved in 2 simultaneous timelines that didn't communicate well with each other. In the first timeline, the investigation continued its accelerating forward motion. The forensic accountant's preliminary analysis of the shadow ledger was completed, and it was worse than anyone had projected, because Holt's parallel bookkeeping had been running not for 18 months but for 26, and the total diversion across that period, across Hartwell and 2 satellite facilities, was quantified at a number that moved the case from a mid-level federal fraud charge into territory that would require a different conversation entirely. Nora didn't learn this number through official channels. She learned it from Pollard, who called her on a Thursday to confirm a scheduling detail for the grand jury proceedings, and mentioned it with the flatness of someone who had been living inside the number long enough that it had stopped landing with full weight. She sat down when he said it. She did the math, reconstituted it. That's not diversion. That's a supply operation. Yes, Pollard said. That's what we're calling it. The implication was that Holt hadn't been supplementing something. He'd been running something. That the sophistication of the shadow ledger wasn't the behavior of an opportunistic diverter who got careful. It was the infrastructure of a person who had built a structured secondary operation inside a federally contracted medical facility, using the facility's own reconciliation architecture as cover over more than 2 years. That was why the incident reports had been closed. That was why the reclassification had happened. That was why Nora Voss, who had been noticing things and writing them down and filing them through proper channels for a year, had gotten nowhere, because the channel ran through the person who was building the thing she was reporting. She felt, sitting with that information, a specific and complicated anger. Not at the investigation, or at Truax, or at the process. At the particular quality of the obstruction, the studied, institutional, completely deniable way that someone in authority had used his authority not just to protect himself, but to make a person doing the right thing feel like she was the problem. She thought about strong guidance. She thought about documented time delays. She thought about 4 years of doing her job well and having it mean nothing beyond the next shift. And then she put the anger in the place she put things she needed to hold without being held by them. And she called her mother, who lived in Roanoke and didn't know anything about the last 3 weeks, and talked to her for 40 minutes about nothing important, and felt better in the imperfect, partial way that phone calls with parents sometimes produced. Holt's attorney contacted the U.S. Attorney's Office on the following Monday. Farr had been right. The news reached Nora through Truax, who called with the specific economy of a person sharing information that was significant without editorializing. Holtz entered preliminary cooperation discussions. Nothing's been agreed yet. The U.S. Attorney will weigh his value against the strength of the existing evidence. She paused. The existing evidence is strong. What does cooperation get him? Potentially a reduced charge on 1 or 2 counts. Sentencing consideration. Not immunity. The scope is too large for immunity. Truax said it with the matter-of-fact precision she applied to everything. It also means he'll be required to identify anyone else in the network, at the other facilities and potentially beyond them. Beyond them. There was a shape in that phrase that Nora didn't press on because she understood she was at the edge of what Truax was going to tell her. The public announcement, Nora said. When does that happen? The U.S. Attorney's Office issues a press statement when charges are formally filed. That's pending the cooperation discussions and the grand jury. Probably 3 to 4 weeks. Truax paused. I want to prepare you for something. When the statement comes out, your name won't be in it. Cooperating witnesses are protected from that kind of disclosure. I know. That means the public narrative of how this case broke won't include you. Not formally. A beat. That bothers some people. Nora thought about it honestly. No, she said. It doesn't. She meant it. The thing that had driven the 9 days of parallel processing and the kept flat face and the 3 a.m. spreadsheet checking hadn't been about recognition. It had been about Marcus Odell's jaw, tight with pain he shouldn't have been in. About a forged signature in a patient confirmation field. About a year's worth of incident reports disappearing into a system controlled by the person she was reporting. She didn't need her name in a press statement for those things to be real. There is one more thing, Truax said. Hartwell's hospital administration has been briefed on the scope of the investigation. They're conducting an internal review of HR practices, specifically the handling of staff incident reports and the process by which Holt's personnel evaluations were conducted. She paused for exactly the right length of time. Your file is part of that review. Your performance evaluations, your incident reports, the corridor interaction about the K-9 assessment, the documentation delays Holt attempted to log. Another pause. I have no role in Hartwell's internal process, but I'm told the review is being conducted by an outside firm. That's relevant to you. Yes? Nora said. It is. She hung up and stood in the supply room for a moment. The same supply room she'd used twice already as the nearest available private space, which meant it had acquired a specific association in her mind that she suspected it was going to keep for a while. Then she went back to the nurse's station and resumed the afternoon. February 28th arrived the way significant days sometimes arrived, looking like a regular day until it wasn't. She was at Hartwell at 1:30, which was half an hour early, because she had a patient discharge to complete, and she wasn't going to leave it unfinished. The discharge was a 70-year-old veteran named Howard Price, bilateral knee replacement, who had been in her care for 6 days, and who shook her hand at the door of his room with both of his and said, "Young lady, whoever trained you did a hell of a job." She thanked him and meant it, and walked him to the elevator. Then she changed out of her scrubs, put on her regular clothes, and went down to the lower-level veterinary intake at 1:55. Farr was already there. He was in civilian clothes, dark jacket, no insignia, and he was standing outside the intake room with his hands in his pockets, and he looked, for the first time since she'd met him, like a man who was not entirely managing his composure. "He's inside," Farr said. "They brought him over from the holding facility an hour ago. Moss did a final check." "How is he?" "He's—" Farr stopped, tried again. "He's been pacing. Since they told me he paces when he's waiting for something he knows is coming. She looked at the door. Does he know? I don't know how to answer that scientifically. He said it with the careful honesty of a man who had stopped pretending he understood everything about the animal he'd spent 6 years with. Practically, yes. I think yes. She nodded, reached for the door. Nora. It was the first time he'd used her first name since the parking structure, and she heard what it was carrying. Thank you for everything, not just... He gestured in a way that encompassed more than the intake room. For doing what you did, the right way, when it would have been easier not to. She looked at him for a moment. I wasn't the kind of man who said things like that carelessly, which meant it had cost him something to say it, and she wasn't going to diminish it by deflecting. You put a photograph on a table, she said. That's where this started. The photograph was Rook's idea, he said. She almost smiled. Then she opened the door. The intake room was small and quiet, with a padded mat in the corner and a water bowl and the flat institutional light of a medical facility's lowest level. Rook was standing in the center of the room when she came in, which meant he'd heard the approach. His head was up, ears forward, tail held still and low. The posture of an animal that was processing, not reacting. She stepped inside and let the door close behind her. He looked at her. She stood still and let him do his inventory. The same thing she'd let him do in the consultation room 3 weeks ago. The slow, deliberate process of a trained animal reading everything available before committing. His breathing was measured. His ears stayed forward. Then he crossed the room. Not fast. Not the dramatic run of movie reunions. A deliberate, straight-line walk, unhurried, with the particular purposefulness of a dog that had decided something and was acting on it. He stopped in front of her, pushed his nose against her left hand, traveled up to the wrist, pressed his face against the scar. Held it there. She put her other hand on the side of his head, gently, and he leaned into it with his full weight. Hey, she said, I got you. His tail moved once, low and slow, the wag of a dog past the age of performance. Just an acknowledgement, just a fact. She sat down on the floor, which was cold through her jeans, and he sat down beside her, his shoulder against hers, and they stayed there in the quiet of the lower-level room, while above them, the hospital did what it did. No, she didn't know, sitting on that floor, that 3 floors above her, in the conference room where the outside HR firm had been conducting its review for the past 2 weeks, a report was being finalized that contained, among other findings, a formal determination that the incident reports filed by Nora Voss between 2022 and 2024 had been improperly closed, that the reclassification of her November report constituted a procedural violation, that the corridor interaction documented between Voss and Dr. Holt on the date of the canine assessment constituted an identifiable pattern of targeted discrediting behavior, and that Holt's attempt to formally log the canine assessment time delays as a staff performance matter was inconsistent with the available record of events. The report was 31 pages. The outside firm's recommendation, on page 28, was specific. A formal institutional acknowledgement to be delivered to Nora Voss in writing, with a copy placed in her permanent personnel file, clarifying the record of the incidents in question. The report would land in the interim director's inbox at 4:47 p.m. Nora didn't know any of that yet. She was sitting on a cold floor with a retired military dog against her side, and the world above was doing what it was going to do. And she'd done what she was able to do, and for the next few minutes, none of the rest of it was the most important thing in the room. Rook pressed his nose against her wrist again. She scratched behind his ear, the left one, the one that made him close his eyes. And he closed them. Outside the intake room, in the corridor, she heard Farr's footsteps moving away toward the elevator, giving them the room. Knowing, the way he seemed to know most things that mattered, when his presence was and wasn't the thing that was needed. The facility hummed. The lights held steady for once. And somewhere in the administrative wing, on a laptop that federal forensic personnel had finished imaging and returned to a sealed evidence locker, a file named Reconciliation Backups waited with the particular patience of documented truth. 847 megabytes of a man's careful, meticulous, catastrophic certainty that he would never be found out, sitting intact and indexed and ready. For the moment when a prosecutor opened it in front of a grand jury and the last wall came down. The grand jury convened on a Tuesday in mid-March, in a federal courthouse in downtown Calverton that Nora had driven past hundreds of times without ever thinking much about what happened inside it. She testified on the second day. She'd been prepared for it by Pollard in a 90-minute session the previous week. Not coached, prepared, which was a distinction she appreciated because it meant they went through what she knew, how she knew it, and what the limitations of her knowledge were, without trying to shape the edges. Pollard was precise and unglamorous about the whole thing, which helped. He told her the grand jury would have questions, and that some of them would feel obvious and some would feel beside the point, and that her job was simply to answer what she knew and say clearly when she didn't know something. She did exactly that. She was in the room for 2 hours and 11 minutes. She talked about MedVault and the reconciliation window and the sync lag. She talked about the incident reports. She talked about the forged administration record and Marcus Odell and the corrected dose she'd administered and documented in real time. She talked about the November corridor comment, any system that generates as many false flags as MedVault does. And she read it from the printout of her personal notes, dated and time-stamped. She was asked once whether she had any personal grievance against Dr. Garrison Holt that might color her account. She considered the question honestly, in the room, in front of the jury, and said, "He made my professional life difficult for 4 years. Whether that's a personal grievance or an accurate description of the record, I think the documentation answers better than I can." Nobody followed up on that. When she came out into the marble corridor of the courthouse, Pollard was waiting. He had 2 cups of bad coffee, handed her one without ceremony. "How do you feel?" he asked. "Like I answered everything I knew." "That's correct," he said. "That's all it was supposed to be." She drank the bad coffee and looked out through the courthouse's tall windows at the Calverton street below. The ordinary Tuesday traffic, people going somewhere. The sky, the particular flat white of a March morning that hadn't decided yet what it wanted to do. She felt neither triumph nor relief. She felt something quieter than both of those things. A completion, the way a long piece of work feels when the last component has been placed, and the whole of it can finally be seen. It wasn't clean. It wasn't a resolution in the cinematic sense where everything snapped into satisfying alignment. There were still weeks of process ahead. The cooperation discussions, the formal charges, the sentencing that was months away. There were still patients who had gone or underdosed during the months when the diversion had been running. There was still a trauma wing running under interim leadership trying to figure out what its culture actually was without the supervisor who'd shaped it. None of that was resolved by her 2 hours and 11 minutes in a federal courtroom. But the things she'd built, the spreadsheet, the timeline, the documented sync lag, the handwritten notes, the real-time correction of a forged record, all of it was now inside a process that was larger than her and didn't require her to hold it anymore. That was what she felt. Not triumph. The release of weight she'd been carrying for 9 months, longer if she was honest, longer if she counted the 3 incident reports and the closed doors and the corridor conversations. She threw the empty coffee cup away and went back to work. The formal charges were announced 6 weeks later. The U.S. Attorney's Office issued its press statement on a Wednesday morning. 4 counts of federal healthcare fraud, 2 counts of obstruction of a federal investigation, 1 count of conspiracy to distribute controlled substances. And the statement named Garrison Holt, Sully Brennan, and 2 pharmacy technicians from a satellite facility that Nora had never worked at. The scope of the operation, as described in the press release, covered 26 months, 3 facilities, and a total diverted inventory that the statement quantified in a number that appeared in the Calverton Register's online edition by noon, above the fold, under a headline that Nora read on her phone during her lunch break. The article was 800 words. Her name did not appear in it. She read it twice and then set her phone face down on the break room table and ate her lunch, which was leftover rice that she'd made the night before and which tasted fine. Dr. Petra Moss sat down across from her 6 minutes into this, with her own lunch and without asking permission, which was how Moss operated. "You read it," Moss said. "Yes." "Your name's not in it." "No." Moss looked at her. "Does that bother you?" Nora thought about the honest answer. 2 months ago I thought it might. Now, she considered. No. What was in it is in it. That's what matters. Moss opened her own container, which appeared to be a salad assembled with the efficiency of someone who didn't spend a lot of time on food. "For what it's worth," she said, The people in this building who need to know what actually happened? No. How many of them? More than you think. Moss speared a piece of lettuce. You have a reputation in this wing, Voss. You may not have been paying attention to it, but it exists. I know what my reputation was. Past tense is doing a lot of work in that sentence. Moss ate for a moment. I'm talking about what it is now. She said it without sentimentality, just as a reported fact. The 3 nurses who covered your sections during the investigation period, they noticed the documentation. They talked. People who'd filed similar concerns that went nowhere started connecting the timeline. She paused. Nobody gets to be invisible in a wing this size when something this big happens. You were the one who held the thread. People know that, even without the press statement. Nora was quiet for a moment. She wasn't sure how to receive that. Not because it didn't matter, but because she'd spent so long operating in an environment where her assessments of situations were discounted that receiving recognition from inside that same environment required a kind of recalibration she wasn't quite through yet. I didn't hold it alone, she said. No, Moss agreed, but you held the part that required the most exposure. That's a different thing. She closed her container. I'm also going to say the character reference I submitted to Ridgeline. I should have done something like that years ago in a different form and in a different direction. I know that. I'm not looking for you to tell me it's fine. It's not fine, Nora said, and it's done. She paused. The optic irregularity in Rook's imaging, the specialist consult. Did you get results? Moss accepted the subject change without commentary. Progressive retinal atrophy, early stage. He has probably 12 to 18 months of functional vision. She said it with clinical accuracy and something underneath it. His world is going to get smaller. I know, Nora said. We're managing it. Moss nodded once, picked up her lunch, stood. The interim director wants to meet with you Thursday, she said, about the HR review report. She looked at Nora directly. Be there. Whatever you're feeling about the institution right now, be there. She left. Nora sat with her leftover rice and thought about 12 to 18 months of functional vision and the adjustments she'd already begun. The consistent furniture placement, the verbal routines, the particular way she narrated her movements in the apartment so a dog with diminishing sight could track where she was by sound. The small engineering of a life rearranged around a different kind of attention. It wasn't perfect. Nothing about it was. But she'd stopped waiting for perfect somewhere in the last several months and found, on the other side of that particular surrender, that functional was more than enough. The meeting with the interim director was on a Thursday at 2 p.m. His name was Dr. Warren Bellick, brought in from a regional hospital network to manage Hartwell's transition period, and he had the manner of a person who'd been handed a complicated institutional situation and had made the decision to look at it straight rather than sideways. He was not warm in the way that some administrators performed warmth. He was direct, which Nora found more useful. He had the HR report on the desk in front of him when she came in. 31 pages, tabbed with colored markers. Sit down, Ms. Voss, he said. She sat. I've read this report 3 times, he said. I want you to know that. Not once. 3 times. He put his hand flat on it. I also want to say something before we get into the formal part of this conversation, and I want to say it plainly. The institutional failure documented in this report is serious. The specific pattern of closed incident reports, reclassified findings, and targeted discrediting behavior toward a staff member who was doing exactly what the system was supposed to support. That's not a procedural error. That's a structural failure at the supervisory level, and the fact that it ran for 4 years without meaningful check is a problem that belongs to this institution, not to you. She held his gaze. Thank you for saying that. It's accurate. Whether it's comfortable is a different question. He opened the report to a tabbed page. The formal institutional acknowledgement, page 28. I'm going to read the relevant portion. He read it. It was precise, institutional language, and it named the specific incidents and the specific determinations and the specific recommendation, and it contained the phrase, the record. With respect to Nurse Voss reflects a pattern of diligent and appropriate reporting behavior that was improperly managed at the supervisory level, which was 32 words that Nora would not have said she needed until she heard them read aloud in a room with another person, at which point she discovered that she had needed them in a way she hadn't let herself acknowledge. She didn't cry. She wasn't going to cry in this room, But something moved in her chest, and she let it move. Bellick set the report down. A copy goes in your permanent file today, with a notation clarifying the record on all 3 incident reports. He paused. I also want to discuss your role going forward, if you're willing. I'm listening. The trauma wing is going to be under transition leadership for at least 6 months. We're recruiting a permanent supervisor. In the interim, he looked at her evenly. We need someone in a senior clinical coordination role who can help rebuild the documentation practices and staff trust in the reporting structure. Someone who is demonstrably not compromised and who the staff already knows. Another pause. I've spoken to Dr. Moss. She recommended you without hesitation. Nora was quiet for a moment. That's not a promotion in the traditional sense. No, it's an interim designation with a pay adjustment. It may lead to a permanent restructuring. That depends on a number of things that haven't been decided yet. He was honest about the uncertainty, which she respected. But it's not a gesture. It's a function this wing actually needs. She thought about Holt's office with its good window and the closed door and the way authority had been used in that space for 4 years. She thought about 3 incident reports disappearing into a system that was supposed to protect the people filing them. I'll take it, she said, on the condition that the reporting structure for clinical concerns goes external, bypasses internal supervisory sign-off, and that condition is written into the interim designation. Bellick looked at her. Then he wrote something down. That's a reasonable condition, he said. I'll have it drafted. She left his office at 3:15 with a copy of the HR report and the particular physical sensation of a person who has been carrying something uphill for a long time and has just been told they can set it down. She took the stairs. 4 flights, all the way down to the lobby, and then back up 2 to her wing because her legs needed the movement and her lungs needed the work, and because she'd learned years ago that the body processed things the mind was still sorting out, and it was better to let it. Garrison Holt entered a cooperation agreement with the U.S. Attorney's Office on the first Monday of April. The terms, which Truax communicated to Nora in a phone call that lasted 4 minutes, were as follows. Holt would plead guilty to 2 counts of federal healthcare fraud and 1 count of obstruction. The conspiracy distribution charge would be reduced to a lesser included offense in exchange for full cooperation, names, structures, documentation of the network's operation across all 3 facilities and beyond. He would receive a sentencing recommendation of 36 to 48 months, with the final determination at the judge's discretion. He would surrender his medical license permanently, effective immediately upon the plea. Permanently, Nora said. Permanent revocation. It's a condition of the plea, not just a consequence. He agreed to it. She thought about that. The license he'd carried for 20 years, the credential that had given him the authority to close her reports and redirect her concerns, and stand in a corridor and tell her that her idea of helping had been a rhetorical gesture. Gone. Agreed to in writing as the price of avoiding the full weight of what he'd built. The network beyond Hartwell, she said. How far? I can't give you specifics. What I can tell you is that his cooperation has opened avenues we've been trying to access for over a year. Truax paused. The Hartwell piece was significant, Ms. Voss, but it was also the piece that cracked the broader picture open. Because of the shadow ledger. Because someone documented the pattern before we had the shadow ledger, Truax said. The ledger confirmed what was already on paper. The spreadsheet and the timeline gave us the framework to know what we were looking for when we went in. A brief pause. You built the map. We used the map. After the call, she sat with Rook for a while. They were on the floor of her apartment, his usual evening position, his back against the couch, and her back against him, an arrangement they'd settled into in the first week that neither of them had renegotiated since. The television was on, but neither of them were watching it. She was thinking about something that had been sitting at the back of her mind for weeks, about the particular kind of institutional quietness that had surrounded her concerns for 4 years. Not active hostility. That would have been easier to name and fight. Quietness. The closed report. The reclassification. The strong guidance delivered in a corridor at just the right volume to be deniable. The way a person with authority could make someone without it feel like the problem without ever saying anything that could be formally grieved. That was the thing she kept coming back to. Not Holt specifically, Holt was now a federal case and a permanent revocation and a 36 to 48-month sentencing recommendation, and whatever she felt about him was less important than what was going to happen to him inside a system that finally had his full documentation in hand. She came back to the structure that had made him possible, the way institutions protected their own architecture even when the architecture was being used as cover for something that hurt people. Marcus Odell had spent 2 hours in unnecessary pain because a signature had been forged in a system that was supposed to make forgery impossible. That was the most concrete version of the cost, but it wasn't the only one. There were other patients, at other facilities, across 26 months, whose charts she hadn't seen, and whose names she didn't know, and whose experiences of that gap between what was documented and what was delivered she would never have access to. She was one person. She'd caught what she'd caught by being present and persistent and willing to build a picture slowly in a personal spreadsheet on her own time. She hadn't been trained for it. She hadn't been given tools for it. She'd done it because it was there, and it was wrong, and the formal channels had failed, which meant the informal channels were all that were left. That wasn't a system. That was a gap that someone happened to be standing in. She scratched behind Rook's ear. He made a sound that wasn't quite a sigh, something between contentment and the specific tiredness of a large dog at the end of a day. "I know," she said. He pressed his nose against her wrist. Sully Brennan's sentencing happened first in mid-April because his cooperation agreement had been the earliest and his case the most straightforward. He received 22 months in federal prison and a 5-year supervised release, with conditions including community service in a healthcare-adjacent setting, which the judge noted with a dryness that made the courtroom go briefly quiet. His nursing technician certification was suspended pending review. The review board's determination came down 6 weeks later as a permanent revocation. The 2 pharmacy technicians from the satellite facility were sentenced in early May, 15 months each, with conditions. Their certifications followed the same path. Holt's sentencing was scheduled for June. In the weeks before it, Nora was asked twice by different people whether she planned to attend. The first time was Pollard, who mentioned it in passing during a check-in call about grand jury procedural wrap-up, making it clear there was no requirement either way. The second time was Priya, the colleague she'd traded shifts with on the morning of the Truax meeting, who had figured out considerably more than Nora had ever told her, and who asked about it directly over lunch in the way that Priya did most things, without preamble, without apology. "Are you going to be in the room when they sentence him?" Priya asked. "I don't know yet," Nora said. "Would it help, being there?" She thought about it honestly. "I don't know what help means in that context." "Closure," Priya said. "People say closure. People say closure like it's a thing that happens in a moment." Nora looked at her food. "I think it's more like a process where the thing stops taking as much of your attention, not a door closing. More like a volume getting turned down." She paused. "I'm already in that process. Whether I'm in the room doesn't change the frequency." Priya considered this. "That's either very healthy or very avoidant." "Probably some of both," Nora said. She went. Not because she needed the room, because Marcus Odell deserved a person who knew what had happened to him in that room, and because the pharmacy tech who'd forged his signature deserved to know, at some level, that what he had done had a witness who remembered his name, and because Nora Voss had spent 4 years being told her presence didn't matter in spaces where her absence was far more convenient for other people, and she was done making herself absent as a form of accommodation. She sat in the 3rd row of the federal courtroom on a Thursday morning in June. Holt came in with his attorney and his negotiated agreement and his permanently revoked license and the particular posture of a man who had made his calculations and was now living inside them. He was wearing a suit she didn't recognize, civilian, not the bearing-enhancing professional clothes he'd worn at Hartwell. He looked smaller, which she hadn't expected, and then she understood that it wasn't his size that had changed. It was the architecture around him. Without the office, without the title, without the 4 years of institutional position that had made him the person who decided what mattered. He was just a man in a courtroom who had built something fraudulent and meticulous and had been documented out of it by a spreadsheet on a personal laptop. The judge went through the conditions of the plea agreement methodically. 2 counts of healthcare fraud, 1 count of obstruction, the reduced distribution charge. The sentencing recommendation. She asked Holt directly whether he understood the terms. "Yes, Your Honor," he said. His voice sounded like his voice. That was the part Nora hadn't prepared for, that he would still sound exactly like himself. The judge sentenced him to 42 months in federal prison, the upper end of the recommended range, because the judge, in the sentencing statement she read aloud, noted that the scope of the operation, its duration, its use of institutional authority to suppress internal reporting, and its direct patient impact warranted positioning at that end of the spectrum. Direct patient impact. Nora heard that phrase land in the room and held it. The judge also ordered full financial restitution, the terms of which would be determined through a separate civil proceeding. She noted the permanent medical license revocation and issued an additional 5-year bar from any employment in a federally contracted healthcare facility following completion of his sentence. When it was done, Holt's attorney spoke to him briefly, and then a marshal moved into the space between them, and Holt looked up once. Not at the room generally, not at the bench, at the gallery. A scanning look, quick, involuntary maybe, the kind of look a person makes when they're checking whether someone specific is there. His eyes found her in the third row. She didn't look away. She didn't perform anything. No satisfaction, no contempt, no particular expression. She just held his gaze for the 2 seconds before a marshal blocked the sight line, because she was there, and she wasn't going to pretend she wasn't, and she wasn't going to make herself smaller for his comfort in a room that had just formally documented exactly what his authority had been worth. Then it was over. She walked out of the federal courthouse into a June morning that was warm for the first time since February. Real warmth, not the reluctant cold releasing of early spring. The kind of morning where the air had temperature you wanted to be inside of. She stood on the courthouse steps for a moment, adjusted her bag on her shoulder, and took out her phone. She texted Farr. Done. His reply came in 30 seconds. How do you feel? She stood in the June warmth and actually thought about it. Like it's over, she wrote. Like it happened the way it was supposed to happen. A pause. Then, that's the right answer. She put her phone away and walked to her car. Fab. Rook's vision declined through the summer in the measured, non-dramatic way that progressive retinal atrophy declined. Not a cliff, but a slope. Consistent and navigable with enough adjustment. By July, he was navigating the apartment on memory and sound, and the particular confidence of a dog who trusted his environment because he'd been given reliable reasons to trust it. Nora had learned, in the months since February, more than she'd ever expected to know about canine visual impairment, about orienting cues, about the importance of consistency, about the way a working dog's other senses were already so calibrated that vision loss was a reduction rather than a devastation. He adapted. Not perfectly. There were days when the adaptation showed its edges, a hesitation at a threshold, a startled response to something he hadn't tracked by sound in time. Days when she could see him recalculating, working the new parameters, making mistakes, and filing them. He wasn't the animal he'd been at 3 years old, or 6, or even 14 months in a backyard with an overgrown lawn. He was the animal he was now, older, slower, carrying old impact sites in his hip and a narrowing visual field and 7 years of work in his body. And he managed it with the matter-of-fact persistence that was, she had come to understand, the deepest thing about him. She took him to Moss every 6 weeks. Moss tracked the progression, adjusted the pain management protocol twice as the summer moved, and noted in July that the hip was holding better than the January imaging had suggested it might. He's stabilizing, Moss said, during the July appointment, running her hands along Rook's spine with the practiced attention of someone who read animals through touch. Not reversing, but the rate of change has slowed. Could be the activity modification, could be the pain management, could be… She paused. Dogs are not predictable in this way. Sometimes what they need is simply to be somewhere they don't have to be watchful. Nora looked at Rook, who was sitting with the patient, slightly put-upon expression that he wore during examinations. He's been watchful his whole life, she said. Yes, Moss said, which is why it matters that he doesn't have to be now. The interim clinical coordination role became permanent in September. Bellick announced it in a staff meeting. Not the trauma wing staff meeting, but a broader one, department supervisors and senior clinical staff. The kind of meeting that set tones rather than communicated logistics. He described the restructured reporting framework, the external escalation pathway that Nora had made a condition of the interim designation, now written into the facility's formal protocol. and he described the personnel changes to the trauma wing leadership, and he described the role as he'd come to understand it through 6 months of watching Nora perform it. What this position has demonstrated, Bellick said, in the particular measured cadence of a man who chose his words carefully in front of rooms, is that clinical excellence and institutional accountability are not separate tracks. They're the same track, and the person doing this work has spent the better part of a year demonstrating that without being asked to demonstrate it, which is precisely why the role is being made permanent. Nora was in the room. She had the same sensation she'd had in Bellick's office in March, the movement of something in her chest that she let move without trying to stop it. She hadn't arranged to be recognized, and she hadn't expected the particular public character of this moment, which meant she was receiving it without preparation. And the unprepared version of herself was more visible than she usually permitted. Priya, sitting 2 seats away, bumped her shoulder once, briefly, then went back to looking at the front of the room. That was enough. More than enough. After the meeting, people came to her in the way they came to people who'd been named in rooms, with the slightly awkward warmth of colleagues who weren't sure of the exact register, some too effusive, some too careful, most landing somewhere in the imperfect middle where genuine things usually lived. She received it all with the same straightforward acknowledgement, because these were people she worked with and would continue to work with, and the distinction between this week and last week was institutional, not personal, and she wasn't going to perform more significance than the moment actually held. Farr called that evening. She answered while she was making dinner, one hand on the phone, the other on a cutting board. Rook positioned strategically near the stove in the way he'd been positioning himself near the stove since week 3 of living with her. Moss told me, he said, about the permanent role. Moss has a larger communication network than her manner suggests. She always has. A pause. Congratulations. It's the same job I've been doing since March. They just wrote it down. Writing things down matters, he said. You know that better than most. She did know that. 47 entries. An 8-minute sync lag. A handwritten timeline on a legal pad. The particular stubbornness of a person who understood that documentation was not bureaucracy. It was accountability made durable. It was the thing that persisted when memory faded and authority shifted, and the people who needed things to be forgotten were counting on them being forgotten. How's he doing? Farr asked. Good day today. Navigated the kitchen from the hallway without touching anything. She looked at Rook, who was looking in the approximate direction of the cutting board. He still knows where the food is. Farr made a sound that was almost a laugh. He always did. They talked for another 10 minutes, mostly about a Ridgeline program update. The foster network was expanding, more families in the pipeline, a new training protocol for handlers that Farr was consulting on. And then he said goodnight, and she put the phone down and finished making dinner, and fed Rook, and ate at her table by the window where the evening light came in at the angle that meant summer was almost done. In October, she was asked to speak at a regional healthcare conference, a panel on internal reporting structures and whistleblower protections in federally contracted facilities. The invitation came through Bellick's office, with a note that it had originated from the DoD IG's office, which meant Truax's fingerprints were on it somewhere, which tracked. She said yes after sitting with it for 2 days. The panel was 4 people, and she was the only clinical staff member. The others were an attorney specializing in federal healthcare law, a former hospital administrator, and a researcher who studied institutional reporting failures. The moderator introduced her as a senior clinical coordinator with direct experience in identifying and documenting systemic medication diversion in a federal facility, which was accurate and considerably more stripped down than the actual experience had been. She spoke for 12 minutes. She didn't tell the story the way she was telling it now. She gave the structural version, the framework version, the version that was useful to a room full of administrators and compliance officers and legal professionals who needed to understand what a reporting failure looked like from inside it. She talked about the incident report process and what happened when that process ran through a compromised supervisor. She talked about the value of personal documentation, not instead of formal reporting but alongside it, as a parallel record that existed outside the structure being documented. She talked about the patient impact, briefly, because the patient impact was the thing that should have been obvious all along and somehow never was until it was documented with a name and a timestamp. She did not make it about Holt. She didn't make it about herself. She made it about the gap. The structural gap between an institution's stated commitment to reporting and the reality of what happened to the person standing in the gap when the institution was the thing being reported. Afterward, a woman approached her, hospital administrator, early 40s, with the slightly worn expression of someone who'd been in the job long enough to have stopped being surprised and hadn't quite gotten to the stage of being resigned. "Can I ask you something honestly?" the woman said. "Go ahead." "Were you ever, during all of it, were you ever sure it was going to land somewhere, or did you just keep doing it because stopping felt worse?" Nora looked at her. It was an honest question, and it deserved an honest answer. "Both," she said, "and neither." She paused. "There were months where I thought it was going nowhere, and I kept building the record anyway because the record was accurate, and accuracy has a way of mattering even when you can't see where." She paused again. "I also kept doing it because a man was in pain that he shouldn't have been in, and that was something I could see directly. I didn't need the whole picture to know that part was real." The woman nodded slowly. "That's a hard thing to sustain." "Yes," Nora said. "It is." She didn't tell the woman that the other thing that had sustained it was a dog pressing his nose against a scar on her wrist. Not because that was too private, but because it was too specific, too non-transferable, too much the particular shape of her life rather than any general truth. Every person who held something difficult held it by a different grip, and hers happened to involve a retired military working dog who had crossed a consultation room on a Tuesday morning and changed the direction of everything by simply recognizing someone he already knew. She drove home through the October evening with the windows cracked and the particular smell of fall in Calverton coming through. Leaves and cold concrete and something else. The unmistakable quality of a season that was clearing the air before whatever came next. Rook was at the door when she came in. He knew her footsteps on the stairs before she reached the landing, knew the specific sound of her key in the lock, and was positioned in the hallway with the patience of a dog who had learned that waiting was not the same as uncertainty. She crouched down and scratched behind his ear. The left one, always the left one, and he pressed into it with his eyes closing. "Good day?" she said. He exhaled. Long, slow, thorough. She sat on the hallway floor with her back against the wall and her bag still over her shoulder, and he arranged himself beside her in the way he'd arranged himself beside her on a cold linoleum floor in February, when she hadn't known yet what was coming, when the spreadsheet was 47 entries and the investigation was 9 days old, and she was still calculating what things were going to cost. A lot had happened since that floor. She had not emerged from it clean or unscathed or with a neat accounting of what she'd lost against what she'd gained. She had a permanent revocation of her supervisor's license in a federal record somewhere, which was not the same as getting back the 4 years of incident reports that had gone nowhere. And it was not the same as the hours Marcus Odell had spent in pain he shouldn't have been in, and it was not the same as whatever the patients at the satellite facilities had experienced that she'd never have full knowledge of. Justice, in the legal and institutional sense, had been done. That was real, and it mattered. But it didn't retroactively fix everything it had covered. What she had was this: a role that matched what she could actually do, built on a reporting structure she had personally conditioned on transparency. A dog who had found her across 7 years and several hundred miles and one broken consultation room door. A body of work, the spreadsheet, the timeline, the real-time corrected record, that had been used by people with the authority to use it to do something that mattered. A morning in June when she'd sat in the third row of a federal courtroom and not looked away. She was not a person who had been vindicated in the glamorous sense. She was a person who had been right about something difficult and had documented it carefully and had waited with imperfect patience while the process worked, and had come out the other side of it changed in the ways that were probably always going to come. More tired in some ways, less willing to make herself convenient in others, sharper around the specific question of what she owed institutions that hadn't earned the benefit of the doubt. Rook's breathing slowed beside her, almost asleep in the way large dogs went almost asleep. Not fully down, one ear still tracking. She thought about the administrator at the conference. Were you ever sure it was going to land somewhere? The honest answer, the full honest answer, was that certainty had never been the thing that kept her building the record. It was something more stubborn than certainty and more practical than conviction. It was the specific knowledge that she was the person standing in the gap, And the gap was real, and stepping out of it because the process was slow, and the cost was high, and the recognition was absent was a choice she was not willing to make. Not because she was exceptional, not because she was fearless, but because she had learned in years of work that most people didn't know she'd done, that the value of a thing was not determined by whether anyone was watching you do it. That was the thing about quiet strength. Not that it was quiet by choice. It was quiet because the work required attention that performance would have consumed, because a spreadsheet built in silence was more useful than a grievance aired loudly, because a dog crossed a room not to make a point, but because the room contained the person he was looking for. And all of his 6 years of training, and all of his current physical wear, and all of his diminishing vision had not touched the thing that made him walk in a straight line toward her. Some things persisted. The right ones, usually. Not always in time, not always cleanly, not always without cost, but with the particular durability of things that were built from something real. She leaned her head back against the wall. Rook's ears stopped tracking. Outside the window, Calverton was doing what it did in October evenings. Cooling, settling, the light going amber at the edges before it went. Somewhere across the city, in the building where she'd spent 4 years learning to hold things quietly, the trauma wing was running its evening shift under a reporting structure that now required external escalation for clinical concerns. Written into the protocol, non-negotiable. Somewhere in a federal corrections facility, a man who had built something meticulous and fraudulent was beginning to understand the cost of his own ledger. Somewhere at Fort Carver, a program was training the next generation of dogs, who would go to families who would give them the bridge they needed before the work began. And in a hallway in Calverton, a nurse with steady hands and an imperfect history sat on the floor with her back against the wall, and a retired military dog breathing slowly beside her, and neither of them needed the moment to be anything other than what it was. It was enough. It had always been going to be enough. The only thing that had ever needed to change was who got to decide that. And somewhere in the last 12 months, quietly, without announcement, that had changed too.